Hi guys, so today I'm going to be looking at the 4P factor model as it relates to phobia. So the 4P factor model has 4 components, which you learned a little bit about in regards to mental illness, and they don't really much change in regards to phobias. So the predisposing factors are pre-existing conditions or factors that make you vulnerable to getting a phobia. The precipitating factors are risk factors which could contribute to you getting a phobia. The perpetuating factors are the risk factors which could maintain or prolong a phobia, or the protective factors which could actually reduce the severity of a phobia. So, like the 4P factor model and the biopsychosocial approach for mental illness, there is a separate one for phobias. Now, you need to remember that this particular table for the 4P factor model and biopsychosocial is different to the mental health one. So make sure that you know both of them. For the SAC more so, because if you happen to think about it, the article is on on phobias, you may want to consider this one over the other one, but have both available since it's open book anyway. I would strongly recommend putting this into your notes. So I'm going to give you an example. I'm going to use me once again as an example, and sadly a lot of this is true. So my predisposing risk factors, which will increase my susceptibility to a phobia of spiders, are the following. Biological. Miss Irving is currently experiencing neurotransmitter GABA dysfunction, which means that she has lower levels of GABA, which means that Miss Irving is more likely to experience higher levels of anxiety and stress, as GABA is considered an inhibitory neurotransmitter because it blocks or inhibits certain brain signals and decreases activity in your nervous system, producing a calming effect. So if I have low levels of GABA, there is a good chance that I'm going to have higher anxiety because there is no neurotransmitter preventing the overexcitation of the stress and anxiety. There is no psychological or social predisposing risk factors for this particular for phobias. It just doesn't exist. So just make sure you remember GABA dysfunction. The precipitating risk factors increase susceptibility and contribute to the occurrence of a phobia of spiders are the following. So the biological. Due to the fact that she's already experiencing GABA dysfunction, the role of Miss Irving's stress response is going to be excessive, and she's more likely to experience the flight, fight, freeze response whenever she sees a spider. So I might run, or I might freeze up and not want to move because the spider's moving, right? And this is the stress response, and it's more likely to be triggered because my GABA is dysfunctional. It's dysfunctional. All right. The psychological. When Miss Irving was very young, she was bitten by a white-tailed spider, causing her extreme amounts of pain. This is true. Only 6 months later, she was bitten again, this time by a redback spider, which involved a large amount of pain and a trip to the hospital. Also true. When she was 10, she was bitten by a funnel web spider, sadly also true, which once again caused her pain. These repeated pairings of spiders and being bitten made her associate spiders with pain. So I've been classically conditioned to fear spiders. So for a precipitating risk factor, classical conditioning does occur, and it is the repeated association between the fear stimulus and some sort of response, which has, if over repeated associations, is going to lead to a learned behaviour. So I've learned through classical conditioning to associate pain with spiders. The social side to things. Despite being bitten more than once, Miss Irving has also experienced numerous other situations where a spider has caused her anxiety, such as a nest of spiders hatching all over her at a tennis court. True. Waking up to find a huntsman on her face more than once. People secretly putting fake spiders on her shoulder to scare her more than once. So these sort of situations, because it keeps happening, right? And it's not just happening in one situation, it's happening on numerous different occasions in numerous different environments. It's just increasing that susceptibility that I'm going to get a phobic response to spiders. Perpetuating risk factors, so these inhibit my recovery and maintain the mental illness or the phobia, right? So for the biological side, as Miss Irving has been classically conditioned to associate spiders with pain, her brain has started to make some changes as well. Long-term potentiation occurred as a result of the pairing of the neurons between the pain and the spiders. And each time another spider experience occurred, the connection between those neurons was strengthened. So long-term potentiation is the strengthening of connections, making them more likely to fire. So I'm more likely, every time I see a spider, going to associate the neuron for, the pain, right? It's going to be connected every single time. So each time I see a spider, automatically, pain. That's what I'm going to associate it with. Psychological, due to the fact that Miss Irving kept experiencing negative spider-related situations such as the tennis court hatching, the huntsman, and witnessing a friend who was bitten by a white-tailed spider and was very sick because of it, also true. The phobia of spiders was maintained through operant conditioning, as each time she saw a spider, she was punished with either pain or fear. Likewise, each time she thinks about a spider, she can only think of the worst case scenario, that they will bite her and she will die. And this is catastrophic thinking. And I only think about all the times that the spiders will hurt her, and none of all the times where there have been hundreds of other times where the spider has just completely left her alone. Now, if we go back to the classical and operant conditioning, right? Classical conditioning conditions the behavior and encourages the fear, whereas the operant conditioning maintains it. So classical conditioning brings on the behavior and operant conditioning maintains it. From the social side of things, Miss Irving knows that not all spiders will hurt it. I know that, but the fear has become so excessive that she's filled with anxiety and dread whenever she sees or thinks about one. She's laughed at when she speaks. She asks others to check the room for spiders before she enters. Sadly, that was a part of my life. As people have laughed at her previously, she's reluctant to seek help because she knows the stigma associated with seeking help for such a thing and is embarrassed about what others will think about it. A lot of people with phobias are afraid to actually seek support because of the fact that some phobias are just ridiculous, right? And sorry for those people who have phobias, but things like a fear of buttons or clouds or, seeing people with beards, it's a real phobia, right? They know that this is, an unusual and irrational idea and an irrational fear, but they're afraid to seek help for it because they know people will laugh at them. So there is a stigma associated with seeking help, so they don't seek it. And it's mainly because they're afraid people will laugh at them. The protective factors. So these are the factors that will actually help you to recover from a phobia. Not necessarily to prevent it, it's more to diminish the effects of the phobia and eventually get rid of it. So it's sort of like the treatments, really. Biological. As Miss Irving is experiencing GABA dysfunction, Miss Irving starts to take a drug called GABA agonists, such as benzodiazepines. And just so we're clear, you have to write benzodiazepines. You cannot write benzos, which mimic GABA to inhibit or calm neurotransmitter function, which reduces her anxiety and stress. Likewise, whenever she sees a spider now, she goes for a run to expend and focus the reaction of the stress response, the flight, fight, freeze. So I'm redirecting that energy of being afraid into going for a run, which we all know I'm never going to do. But that is the whole point, right? You're trying to get rid of that, that anxious energy into something more productive. From the psychological perspective, Miss Irving is also starting to see a psychologist who is using cognitive behaviour therapy to change negative thoughts and feelings about spiders into more positive ones. Likewise, the psychologist is using systematic desensitization to make her more desensitized to spiders, and I'll go into what that is on the next slide. Social. Miss Irving's family also getting involved in her treatment and have been having psychoeducation training where they learn more about Miss Irving's phobia and what brings it on. They've been taught to challenge her unrealistic thought about spiders, that they lay eggs in your ear whilst you sleep. This is a real thought I had. And are no longer engaging in behaviours which lead to Miss Irving engaging in avoidance behaviour, such as killing the spider for her. So by not, killing the spider for me, it makes me confront that fear. It makes me realise what I need to do in order to have normal day-to-day functioning. And it's something that a lot of people just give into. They don't want to cause their friend or their family member pain, so they take away the scary thing. But they shouldn't. They should make them face it head on. All right, so systematic desensitization. And this is a step-by-step process. VCAR will actually say that there are 3 steps, but I've actually broken it down to 5 because it's easier to understand it when it's 5 steps rather than 3. I know that sounds illogical, but it is. So step 1, a psychologist will teach Miss Irving breathing and relaxation techniques to use when confronting the spider. So teach me, breathe in and out, count to 10 and then breathe in and out. And it's trying to get you to focus on your breathing rather than the fearful stimuli. Step 2, Miss Irving will then create a fear hierarchy, and it's like a ladder, which is a list of feared situations involving spiders, ranked from least to most anxiety producing. And you can see in this one here, I've actually done one here. So the first step would be looking at a cartoon spider, and that's worth about 10. Then there's a picture of a real spider, then talking about spiders, then watching a video of a spider, then being in the same room as a spider whilst it's in a case, and then being in the same room as a spider when it's out of a case. And then last but not least, the very fear-inducing situation would be me holding a spider, which is never, ever, ever going to happen. All right, so step 3, Miss Irving will experience the least anxiety-producing fear on the fear hierarchy and use the relaxation and breathing techniques to deal with this fear of spiders. So as I'm looking at the cartoon spider, I have to take deep breaths and count to 10 and then breathe out. So I'm focusing on my breathing, right? So I'm just calm whilst I'm looking at the cartoon spider. And then once I'm completely relaxed, I no longer have any fear of the cartoon spider, I move up to the next step of the fear hierarchy, and that's step 4. Right, so I won't move on to the next step until I'm completely relaxed and I no longer show a fear of that particular step in the fear hierarchy. So my next step would be to look at a picture of a real spider. Talking about spiders, obviously I'm fine with that at the moment. It still makes me a little bit jumpy, but still. All right, next one, step 5. Miss Irving will continue to move up the fear hierarchy until she has reached the top of the hierarchy. I'm just going to say right now, I have not got past the being in the same room as a spider behind a glass case. I have not got past it. I don't want to get past it. It is never going to happen. Anyway, that is a systematic desensitization. You're going through a step-by-step process to desensitize you to a spider. So this is what it would look like in regards to the 4P factor model and the biopsychosocial approach. So if you happen to look at it, predisposing risk factors was just the neurotransmitter dysfunction. Then we have the role of the stress response, the flight, fight, freeze response, classical conditioning. That is what starts the behavior, develops the fear of spiders. All the times that I have been bitten, all the times that I've had spider experiences, that tennis court, ooh, that's bad. Anyway, perpetuating risk factors, long-term potentiation, because I keep forming a connection with pain and suffering and fear and spiders. The neurons are connecting and strengthening each time those sort of interactions happen. Operant conditioning maintains my fear of spiders. And then cognitive bias, including memory bias, so I only ever think of the bad times that spiders have existed. Catastrophic thinking, I think the worst case scenario is going to happen. If I have a spider in my bedroom, it's going to crawl down and lay eggs in my ear or in my hair. They were also things I had. Anyway, and then I'm not going to seek support for it because people will think that I'm crazy. And there's a stigma associated with seeking help, so you don't. Protective factors, I'm going to use GABA agonists such as benzodiazepines. I'm going to use controlled breathing for systematic desensitization. And then I'm going to exercise in order to get rid of that energy associated with fear. I'm going to use CBT strategies, which is cognitive behavior therapy, to change my negative thoughts about spiders into positive ones. I'm going to use graduated exposure, which is systematic desensitization. And just on that note, you must write this. You cannot just write graduated exposure. You have to write systematic desensitization. And the last one is psychoeducation for families and supporters so that they challenge your unrealistic thoughts and they encourage you to face the spider or the fear.